Hi, my name is Dr. Latif, and I'm a trained DBT therapist at UConn. Today I'll walk you through the what skills and the how skills, which is important to core mindfulness. So Amanda, tell me about an environment that makes you feel stressed.
Well, first off, I'll start with my grades. I haven't been doing as well as I want to be. I'm failing French, and it makes me feel like a failure and that I won't be able to do what I want with my life.
It seems like you're doubting yourself and feeling like this one class will make you fail school. Do you agree?
Yes, I have some anxiety, and that makes me overthink and assume the worst.
Do you think your anxiety gets to the best of you, and especially in the way you're doing well in school?
Yes, my hands shake and my thoughts are racing. I have a really difficult time concentrating on studying for exams and completing homework when I feel this way.
I can understand how this would stress you out. Have you tried reaching out to your TA or alternative tutors?
I don't feel very confident right now, so I've been avoiding it. Now that I'm at such a big school, I feel intimidated by the big lecture halls and I experience really bad anxiety.
I want to emphasize that I'm here as a part of your support system. Let's go through some coping strategies to help you work through your anxiety. After, I'll give you a diary card to fill out as your homework next week. I want you to write down every situation that comes up that makes you feel anxious and what coping strategy you've tried to use to alleviate it.
Okay, thank you, Dr. Latif.
Welcome back. Today we're going to be discussing distress coping skills. Jackie, you mentioned that you were having some trouble with your boyfriend. Would you like to discuss that in the group today?
Yes, I've been fighting with my boyfriend. We haven't been getting along. After we got into a fight, I started crying and I can't even explain myself. So I just went into my room and fell asleep. I've been sleeping through class, work, and meals. I just can't get myself out of bed. I'm not motivated to do anything.
Thank you for sharing. Let's walk through the accepts method of distracting yourself from unpleasant emotions. Let's start with A. What are some things you enjoy doing?
Well, I like to run track. It helps me clear my head. I also like to go horseback riding because I love animals. I love being around animals. I like to hang out with friends to make me laugh also.
That's awesome. How do these activities help you be involved in the community?
Well, I like to volunteer at the animal shelter. I love to play with puppies. It makes me so happy.
Does that help you stop thinking about problems with your boyfriend?
Yes, I think it helps me focus on something else outside of myself.
And how does that make you feel?
It helps me feel better about myself instead of how bad I feel about fighting with my boyfriend. This arguing has been really draining, and having some time away from that to think is really helpful. The shelter gives me a sense of purpose and an escape from my bad thoughts when my boyfriend and I fight.
That sounds like a great way to cope with when you and your partner have a fight. Do you think that this strategy can help you keep you from feeling overwhelmed the next time you and him have a disagreement?
Yeah, I think that would really help.
Thank you so much for sharing, Jackie. Taylor, would you like to talk next? Welcome back. The third part of our module will focus on emotion regulation. The goal is for our patients to identify and label their emotions in order to correct them. Taylor, would you like to share first?
Yes. Well, lately I've been so stressed and busy with exams, I tend to lash out at my boyfriend, and it's been putting a huge strain on our relationship.
Have you been eating and sleeping regularly?
No, I've been so stressed out that I've been skipping meals, and I haven't been able to sleep as much as I should. I've also been skipping going to the gym lately. It just hasn't seemed worth going when I have so much else to do.
Okay. Do you think getting back on those things could help you feel more on track and feel more in control of your emotions?
Yes, I feel like I would be more motivated to get my work done on time and feel more emotionally stable with my boyfriend. I think I just need to do better to take care of myself.
Okay. What is one thing that you can do every day in order to help you feel more in control of your emotions?
I don't know. I don't really feel like I have a lot of control. I don't see anything helping me right now.
Okay. Maybe you can start by just taking 10 minutes out of your day just to do something for yourself. Do you have any hobbies?
I used to like kickboxing. There are classes offered at the rec center a couple days a week. I just haven't had the motivation to sign up yet.
That also works. Taking a couple days out of your routine could definitely help.
Okay, I'll sign up for a couple kickboxing classes.
Good to hear. I hope to hear an update from you during next week's session. Thank you so much for sharing. Kiani, would you like to speak next?
Sure.
Welcome back, everyone. Congratulations for making it this far. We're now at our last module. Today's all about interpersonal effectiveness. I have Kiani here with me, and you're going to share with us your story.
So I'm working at a restaurant and I really wanted the manager position, but my best friend got it instead of me. And now we've been arguing about it.
Has this affected you and your friend's relationship?
Yeah, it makes me feel inferior and question why I'm still working there.
It's important to recognize your emotions during this time since they are so important. But it's also important to keep your friend's emotions in mind as well. Do you know how she feels about this promotion?
She's very happy about it. I feel like she's rubbing it in my face. It makes me really mad and it's really unfair. I've tried to keep it in, but I lashed out at her the other day and I feel horrible. It's not her fault that she got the promotion, but I feel like she's being really mean about it.
Can you explain to me what was said in that argument?
Since she's been making me feel inferior, she's been accusing me of being jealous and that I shouldn't be mad about it. She makes me feel like I'm overreacting and that I need to apologize for everything to save our friendship.
Well, it's okay to apologize once for lashing out your friend to maintain your relationship, but there's no need to continue to dwell on it. A better strategy would be to sit down with her and really be honest with her.
You're right. I overreacted and I feel like my friend needs to hear how I feel about this in order for us to settle it.
Thank you.
Hi, my name is Jackie. I'm a trained clinical psychologist specializing in patients with borderline personality disorder. Today I'm going to walk you through Amanda and I's session. Hello, Amanda. I hope you enjoyed your week. Would you like to tell me a little bit about it?
Yeah, sure, but I unfortunately had a rough week.
Okay, I'm here to listen. What happened?
Well, I'll start with Monday at school. I went to the bathroom and I overheard a group of girls spreading rumors about me. I couldn't believe it. They used to be my best friends. They keep bullying me, and lately I feel really alone.
I can empathize with you. I see how hard this is for you, but I want you to know it is not your fault. You can't change other people's actions, but you can change how you react. Let's work together to change your thoughts about the situation so that you can come out of this stronger.
Okay, I'm willing to work with you on this. I really don't want to feel this hopeless anymore.
Let's start with your thoughts and feelings after you overheard these girls in the bathroom.
Okay, I feel betrayed and that there is no way out of this.
How do you cope with these thoughts?
I went home that day and I slept for hours. This has been going on all semester. I feel like I will never fit in at my school and that nobody accepts me. Sometimes I have thoughts of self-harm to cope with my stress.
Amanda, just know that reaching out to people you trust can help you at a time like this. Let's talk about people in your life that make you happy.
Okay, sure. Well, my mom and I are close.
A way to cope with this situation is to reach out to people you're close with. It's important to surround yourself with those who lift you higher and support you.
Yeah, you're right. I mean, at first I was a little ashamed to tell my mom, but now I think I should try. She's a good support system in my life.
I want to emphasize how important it is to be positive when you're going through a hard time. I know it sounds redundant, but we can work together to help you get to a more positive state. Please don't blame yourself. It's unfortunate these girls are taking out their stresses on you. If you're willing to work with me, I can help you come up with better strategies to not let mean comments affect you as much anymore.
Okay, I trust you. What's the first step in all of this?
For homework, I like you to work on a diary card. In the diary card, record your thoughts and feelings, whether you're sad, angry, or when you have thoughts of self-harm. I also want you to record when you are feeling happy. Next time we see each other, my plan is to go over your diary card so we can reflect on it.
Okay, thanks. I will.
I believe we'll get through this as a team.
So I've had this patient. I've been seeing her for about 4 to 5 months, and I'm really excited for her because we're nearing the end of her treatment. And, I think it's ready for her to terminate and finally go off into her own life without me there all the time. The only thing I'm worried about is I'm just nervous if she's gonna be, willing to end therapy. So I don't know. She has major generalized anxiety, but her symptoms have been very minimal this past month actually. So I don't know, I'm just nervous to see if she's ready or not to leave.
I mean, if
if you're nervous about her leaving, how long have you been seeing her?
45 months, about 5 months,
And how often have you been seeing her?
once a week.
Once a week? I know I've had a patient in the past that had a similar issue as your client with generalized anxiety. And what really helped them was sort of weaning them off rather than trying to stop right away with the therapy sessions.
Right, yeah.
So if you've been seeing her once a week, maybe
Bi-weekly, every
Yeah.
2 weeks. every 3
bi-weekly
weeks.
for a little while, then every 3 weeks for a while, until you both feel comfortable with the transition out.
Okay.
And then once you get to that point where you're seeing her less and less often, just make sure to have a plan for the future with her, just so she knows how to go about things in a better way, and she can be able to manage things on her own without the help of you so much, so that she's not just like kind of stuck out there not knowing exactly what to do.
Right.
Just make sure she has a plan and knows how she's gonna be able to deal with her anxiety by
Okay.
herself.
Yeah, those are some great suggestions. I just want to make sure she's very comfortable towards the end, and she makes all the decisions herself, and that she's comfortable in those decisions.
Yeah.
So yeah.
It just sounds like it's time for you guys to have a conversation about where the therapy is gonna go for its next step.
Okay. Sounds good.
I'm happy you and your client are having good progress.
Thank you.
Okay, so you had a client you wanted to talk about?
Yeah, so I had this patient and we were doing so well. We were getting so much progress made during therapy sessions and during our treatment, and for some reason it just seems as though we were going on this positive slope upward from day one, and now it just seems like we've gone down out of nowhere. And I'm sure it's so frustrating for her, and it's definitely also a little frustrating for me, and I'm just not sure exactly the best way to go about it.
Okay. How long have you been seeing this patient?
About 6 months now.
Okay, so I can definitely see how that can be a frustrating situation for you as a therapist to work with her for so long and then all of a sudden feel like you're back at square one with her.
Was there anything in therapy sessions last week or a couple weeks from this session that showed that she was having a hard time with something?
Well, she did tell me that was an issue with her mother. Her mother is sick, but she's not exactly sure if it's something very serious or not yet. The tests haven't come back yet. She's not sure, but that definitely, I'm sure, added to the anxiety that she already feels on a day-to-day basis.
Okay. Well, it sounds to me that it might not be a complete relapse, and it could have been that she was just having a bad day or a bad week. So I would suggest keep using the tools and the techniques that you've been using with her to treat her anxiety, and see where it goes from there, and kind of just work with her like you have been doing for the past few months, and see if any positive changes arise from doing that.
Thanks so much. That's really helpful, guys. Thank you.
So I had this client this week that has been having a really difficult time. They have suffered from PTSD, from abuse as a child, and they have some anger issues as a result. I've been working one-on-one with this client for the past 3 months, and we were talking, and they had an outburst of threatening my safety and the safety of the other clients in the office. And I just wanted to bring this to the table today because I don't want to affect the therapeutic relationship that we've had, but I definitely could use some insight as to how I should approach this when I see them next week.
Okay. Well, your safety is obviously our number one priority. Are there any measures being taken to make sure that you and everyone around you and your office are safe from this patient?
Yes, we've done safety training as part of our training when we got employed.
Okay.
So we've done restraint training and other trainings to help with situations like this. I was just pausing to use some of the restraint because they were just verbally threatening. And I don't feel like that would be an easy thing to recover from with the therapeutic relationship if I did have to restrain them.
Okay. Yeah.
I think that as long as you know that you're going to be safe, if anything were to happen, the next step would definitely be to try to just talk to the patient and see what exactly triggered this reaction in them and this behavior, and try to make it so that this can be a learning process for you and them. You'll understand more about their issues, and they can maybe find a different and more effective, better way to handle this type of situation in the future.
Yeah, I agree. I would say definitely try to get to the root cause of their anger and see what's really making them, show all this built up anger and tension that they've been holding on to, and kind of just going from there and keep doing what you've been doing.
Yeah, I luckily was able to talk them down during that session.
Okay,
They
good.
got a lot calmer by the end of the session, but I really appreciate your guys' input on this, and I really hope that I can make some progress with this client.
Great.
Thank you so much.
No problem.
Hi, my name is Dr. Rodriguez, and today I'm going to demonstrate phone coaching during DBT with a patient experiencing anxiety. Hello, this is Dr. Rodriguez.
Hi, Dr. Rodriguez, it's Vashti. Sorry to call so late, but I just really needed your help right now.
No, it's fine. You know that I'm available via phone whenever you need me. What seems to be the problem?
Well, I had an argument with my roommate, and it's just really causing an issue for me. I can't stop thinking about it, and it's really stopping me from falling asleep. I feel so anxious about everything that happened earlier. My thoughts are really racing. We had a small argument about chores. It wasn't even a really big deal, but just the fact that there's still some tension kind of just makes me feel really uneasy right now. During the argument, I was sure to use gives. I remembered that from group, so I was sure to be mature about everything. I used appropriate language, made eye contact with her, and validated what she was saying. But other than that, I still felt tension with her afterwards, even though it was pretty much resolved. And because of that tension, I just really feel so anxious that I just cannot fall asleep.
Well, I'm happy to hear that you were able to apply gives from our group discussion, so you should definitely be proud of yourself for that. I know that in the past you've had trouble with becoming overwhelmed during confrontational situations, so this is definitely a great improvement. Now we should focus on the anxiety that you're feeling at this very moment. Do you remember the skills that we discussed in group about distress tolerance?
I'm actually having a little trouble remembering. Do you mind reminding me?
Sure. So one thing you can do is use the acronym ACCEPTS in order to momentarily take your mind off of these thoughts that are keeping you from sleeping and forcing your mind to race.
Oh, okay, yeah, I remember accepts from group. I guess I can try watching a movie or maybe reading a book. I think that'll definitely help me to get my mind off of things and focus on something else so that I can fall asleep. Thanks for that idea.
Those are both really great ideas, and no problem, I'm happy to help. Don't forget to fill out your diary card so that we can keep track of these feelings as they're happening.
Okay, yeah, I'll be sure to do that. I actually already started my diary card for this week.
Great. Don't hesitate to call again if you start experiencing any more anxious symptoms. Have a great night.
Good night, Dr. Rodriguez. Thanks so much for all your help.
Yeah, baby. Ay, I want you to be mine.